Welcome everybody to Go Local Live. I'm Josh Fenton, CEO and co-founder. Couple quick pieces of breaking news. One is Bernie Sanders has dropped out of the presidential race, clears the way for Joe Biden to face Donald Trump in the November election. Secondly, Jennifer Lawless, political science professor at the University of Virginia, will join us at 3 p.m. talking about the implications of Sanders pausing his race and allowing Joe Biden to move forward. Secondly, is the unemployment numbers are quite daunting. 165,000 Rhode Islanders are either filed for unemployment insurance, temporary disability insurance, or the new gig economy federal payments. 10,000 of those, quote, gig workers, also small business owners who are not eligible for unemployment insurance, filed yesterday alone in Rhode Island. I would expect that similar numbers are filing again today. So 165,000. The only potentially good news out of this is Brown University alum Janet Yellen, in an interview with CNBC, said that she thought that jobs would recover very quickly once restrictions were taken off. Let's go to Dr. Michael Fine, former director of the Department of Health. Dr. Fine, thanks so much.
Good afternoon, Josh. Nice to be here.
Great. Let's jump to the numbers. Most everything is up. What are the trends you're seeing?
Over 300,000 recoveries. That's good news. 1.455 million people around the world tested and infected. We assume many more people are infected but not tested. That's an increase of 90,000 over a day, and that's continuing to rise. In the United States, 404,000 cases, again, continuing to rise, 35,000 a day, and that continues to go up. It has not plateaued. 83,000 deaths around the world, increasing by about 7,000 a day, with the rate of increase continuing to go up. So I would imagine we will cross 100,000 deaths by the end of next week, if not by the beginning of next week, unfortunately. And in the United States, almost 13,000 deaths, almost 2,000 deaths in 24 hours. That number is continuing to rise as well. So we have not hit the peak around the world or in the nation yet. In Rhode Island, about 1,229 positive cases, positive tested cases. 147 new in the last 24 hours, 123 people in the hospital, 40 people in the ICU. That's continuing to go up, but the rate of rise is pretty predictable. The rate of rise hasn't exploded, which is a good thing. And if this growth continues in hospitalization and ICU beds, I would imagine we will start to see a peak in 2 to 3 weeks. We will be really straining at our bounds in 2 to 3 weeks. That's when we're going to push on the number of ICU beds that we have available to us.
End of April, early May is what it's looking like here in Rhode Island. Is that correct?
Yeah, I think understanding that, these numbers are a 3-week look back about what's happening. We don't know what's happening today with the spread of infection. And until we have a better handle on that, all predictions are not particularly accurate, not perfectly accurate anyway.
Dr. Fine, tell me what you think the state should be doing in order to get back to work. As I understand it, those that have been quarantined, may or may not have had the coronavirus, need to be tested for whether or not they've got the antibodies. Is that correct?
Well, I think what we want to see is the capacity for testing people at the end of quarantine, to make sure we're picking up the people who are asymptomatic carriers. And I don't think we quite have that capacity yet. We're just getting our hands around the capacity to test people with symptoms. So
don't we need to have both testings going on, though, in order to shorten the time period to be able to open things back up?
I think we do. I think we need to do that, and I think we need to be able to isolate people who are infected out of their homes if their houses sell for safe isolation or for isolation that is not likely to create spread inside households.
We're having some audio problems here. I'm going to wrap up with this last question. What's your recommendation going forward right now?
For people to keep doing what they're doing, for people to work hard at social distancing, to work hard at being careful in their households, and to isolate if they're sick.
Dr. Fine, thanks so much. Let us wrap up. A quick scheduling note, 2:30 today, Governor Raimondo, 3 o'clock, political scientist Jennifer Lawless from the University of Virginia. Thanks so much for tuning in.
Thank you.